Well, greetings again. This is Dr. Bill Wyatt with the American Orthodontic Society, and I'm going to try to show things that people ought to be taught in dental schools, especially in the Department of Pediatric Dentistry. They should be taught things in orthodontics, and I'm going to hound on that subject and show many different things that pediatric dentistry ought to have orthodontics, that they do little bits of it along the way. Now this video I'm going to show you is something I came up and I published this years ago, back in 1970. So I was doing this in the 60s, and I came up with a method of preventive and interceptive orthodontics, which is not taught in the dental schools, and it's not taught to the pediatric dentist for certain. So let's get in here and see what it is. You can do things to the deciduous teeth, and you can help nature straighten the teeth out. And this is a cinch. I mean, you can do it. And you can take children with, if they don't have any deleterious habits or anything, and their teeth are slightly crowded, you can bring them in without doing any other orthodontics. Let nature straighten the teeth out. That's the best way you can possibly do it. The forces in the mouth straighten the teeth, and then they hold them that way as long as it is. So let me get started with this. It's going to take a little while, and if you're just thumbing through this, go on and do something else. But if you want to learn something about pediatric dentists, stay with me for a little bit, and I'll show you some stuff that really works in here, and they've tried it, and it works. Now, many kids will come in, and their permanent teeth are bigger than their baby teeth. So here are 3 permanent teeth. This comes in. The other one, you can see a little bit of it over here. It's back behind here. Now, people come in, and so they say, oh, we need some space for this. What we'll do, we'll just extract these cuspids right here. These are deciduous cuspids. If you take those deciduous cuspids out, you're going to leave a gap way down in here, and the developing cuspid underneath here coming up will drift forward into that space. So this is the wrong thing to do. You should give these permanent teeth only the space that they need to come in. And so you can do that by doing a pulpotomy, or you can cut this. Let me clear this up just again here. Now you trim this permanent tooth here, and you look in your x-ray, and this deciduous tooth, and you see how big this permanent tooth is, and the tongue will move it into this gap. But you got to go over another side of the mouth and take off the same amount of tooth, and you leave the whole root in here. The root's still down in here, and that's going to take the permanent cuspid that is erupting in here, won't drift in this space. It is wrong to take out the deciduous cuspids and think you've done the job. It'll straighten the thing out all right, but then the permanent cuspid will go into this space where the root was, and now you lose arch length. And I don't care who you are, that's what's going to happen in here. If you take that out, this side, they will drift together and you will lose arch length. All right, let's see what we do here. Let's go ahead. What you really ought to do is learn how to do these pulpotomies. Now on this side, the other side is crowded out over here. We're going to have to do the same thing over here as we did over on this side, and these teeth will shift over in that direction. without you doing a blooming thing. If you've got the person who's breathing right, who's swallowing right, who doesn't have any sucking habits and messing around with their teeth, let's see. I'll show you how it goes. Now, up above you got the same problem. You got a lateral, deciduous lateral, two big centrals are coming in here. We're going to need some extra space up here. Don't take the teeth out. Take away just enough so that permanent teeth have room to come in. And you leave the root, and the root will absorb. This was done several years ago when we didn't even have to wear gloves, and so you see the fingernail print in there, but it still works. I came up with this back in the 60s, and I've taught it for years, and still there's very few people do it. I don't know if they got scared away from it or whatever. Now, here is on the bottom arch again. See, they crowded over here, and this is crowded, and this is crowded. This tooth is coming up under the enamel on this deciduous tooth. Now, the cells that go in front of the erupting tooth eat the dentin away, but they have nothing to do with the enamel. So it gets hung up under the enamel, and this tooth will sit there, and this tooth will have a root enough to hold it down, and that will not come on up, and you'll have something permanently deformed in here, where if you go in early enough, trim this tooth down, and go down here and do a pulpotomy. And I'll show you those pulpotomies can be done so simple. You can't put a rubber dam on there and do it because you grind the rubber dam up, and you don't need it. Now we're going to come over on this side and take enough of this tooth off so that these teeth can drift in this direction. Now watch this take place. All right, here, there it is again. You can kind of see the roots of these permanent teeth coming in. The tongue, if this person is swallowed correctly and everything is going, breathing through their nose, and by the way, if you have a child and you want it to really develop properly, it should nurse for about 2.5 years. There's no way you can breathe through your mouth while you're nursing. Now, I don't have any double-blind study on that, but people who nurse for a long period of time, babies who nurse, develop the airway because they breathe when they're nursing, and they can't breathe through the mouth. You stick a bottle in their mouth and feed it to them in just a little bit of time, and now they can breathe through their mouth, and they do. And so when breathing through the mouth, the maxilla go. I just throw that in on the side, and we'll talk about it later. Now we're going to trim this tooth, and we're going to trim this tooth, and we'll do a pulpotomy on it. Now back when I started this, I used a long tapered diamond on it to do the pulpotomy. Just get a brand new one each time. I got to where we could get a long carbide burr that will do this and just have a brand new one, as sterile as you can get it, as clean as you can get it, and that's what we take the tooth down with. Now, I infiltrate around the tooth, just put anesthetic down in here and infiltrate where the tooth they don't feel anything doing this. And now you cut down through here and go right through the nerve, but watch this tooth here. When you get out here, get out in front of it and snap that off, and you can see the tooth, and you can go around it, and so you won't touch that permanent tooth with that burr. We get it down like that, and we take some tissue out. You don't have to take tissue out, but we did in this particular case. And now we pop that away, pop it off. Now I can see this tooth and go around and ream it out down here. Don't do it with a disc. You can't possibly take this down with a disc or anything. So you do a long burr, and you go in here, and you can't put a blooming rubber dam on it. You don't need to. I've done thousands of these things, and I've never had one of them blow up. But I had an old surgeon did one from somebody, and I had a case, and it tooth blew up, but it still worked. And somebody in Atlanta, Georgia, got up bitching about it, and wanted to leave, and they did. But anyway, I have never had one of them that blew up that we did. These are healthy teeth. Now we take this burr and go down in there and ream that out. Now you mix zinc oxide and eugenol. That's all you need. You don't need any form of creosote or anything else in there. Just take zinc oxide and eugenol, put your pile of zinc oxide in here, put a drop or two of eugenol in, and mix it till it's so thick, and then pat it out on the paper, whatever it was, until you can pack it like amalgam. Now I just took a spoon and I cut off this, and this is stiff zinc oxide and eugenol. Now you have it on the end of that like that. Now don't worry about the bleeding in here. Push this down inside there while it is bleeding. Don't try to dry it out, for goodness sakes. And if you want to aspirate, all right, but just push it in there. It'll push the blood out of the way. Now you go down in and you pack that in there, and it'll stop the bleeding. And now trim this up where it doesn't cut the lips or anything else. And you've got room enough over on this side when this tooth is going to move over in this direction, and we go over to the other side of the mouth. We trim that down, and we do the pulpotomy on that side, and we pack it, and we smooth it out and smooth the teeth up a little bit, and you leave it there. And nature will straighten these teeth out, and the root of this tooth that's left in here will resorb away, but it'll keep the cuspid. It'll hit that and start up here, and you won't lose any arch length in doing it. And so they will watch this come along. Now we go up and you do something up above. Nature pushed these teeth in. I haven't touched them with any kind of thing. That is the best orthodontics you can possibly use. It not only straightens the teeth up, it serves like a retainer too, because that's where the pressure was equal. The gum and the lips and everything are equal at that point. Now we got to do the upper tooth. So we come back in and we do the same thing up above. And you see where this tooth came from back down here? It was hung up under this, and it's moved in here, and these teeth are moving over in that direction. This is taking up this space, and it's straightening up, and you don't even touch it, you see, other than prepare that. Now, this goes on. Now we come in and do the upper, and the same thing. The lip will catch this out here, and the tongue will push the other one in there, and watch this get better as we go along. Now that's the first phase of this, and now we're going to have to come back and do the second phase of it. Now we've done this. You'll watch the upper come in. There's the upper. Looks pretty bloody and everything. You get to where you can do that. You can do these pulpotomies much quicker, and you can take the tooth out, and you can come back in there, and this tooth will take up this space. If you need extra space, you take it off. The tooth has no feeling in it at all. Don't get up close to the nerve and leave it saying, I'm not going to get into that nerve. I'm just going. That tooth will give you a heck of a problem. It'll hurt and bother and everything. You do the pulpotomy, you don't feel anything in there. And you pack it with zinc oxide and eugenol, and I mean, I don't care if it goes out the root. It doesn't matter. This will break off, and the tooth will come in anyway. And this disappears. All right, we're going to watch this. You see this is getting better down on the bottom right here. You see these teeth are lining up better. That tooth now has caught up with these other teeth. It was way behind. Now it's sliding over, it comes up right in there. Now, the up, that's the lower. There it has taken that spot right in here. This can move over here. When it does, this will go away. Now we got the upper. This lateral has come into place there. Let me go back. There it is. That's lined up that good. That may need a little more. If you don't, you can take something and grind out a little bit and let those come in there. You don't have to even deaden them anything. You just take a little of that off. They don't feel any pain with that. That tooth will come out and be eaten away with permanent tooth coming up. Now the bottom is still off some. We're just getting ready to do the second phase of this, where we're going to have to take this deciduous tooth off, figure out you got enough room for the cuspid and the first bicuspid, and you're going to leave enough room for the second bicuspid to come in there. Now we go on to the next. You see that's getting better all the time. Now these deciduous teeth are lost by the permanent cuspid coming in underneath here, but it's cattle that follow the root of this cuspid up, and now it's running into the laterals on the permanent lateral, and the permanent cuspid will go into place. But you see, when this tooth's ready to go and that cuspid's coming in, you take this one out, and now we're going to give room for the cuspid and the first bicuspid, going in here, and you're going to save enough for the second bicuspid back there. Now that's cut out, and you see where those teeth did. If you had pulled those teeth, the permanent cuspid would have run up in there, but it had to follow the root up, and now the bicuspid coming in here, and the cuspid, they don't have quite enough room, so you look on your Pediatric, and you go in there and you take off, and we'll do a pulpotomy on these teeth back there. So in one of those, see, this cuspid came in over here, so we take this tooth out. This one's headed in right here, so we take that deciduous tooth out. You go ahead and remove it, and now remove enough off of this second deciduous molar back here and do the pulpotomy from the side. We take that out. We're going to take that off of the second deciduous molar. We cut the side of it out. We take a long shaft round burr, and we go in and we go down one horn, then down the other horn, and you pack zinc oxide and eugenol in there. I mean, you fill it in. I mean, you pack it in there just like you pack an amalgam. It's heavy, hard stuff. You don't have to crown or do anything to that tooth. That'll stay in there till that tooth goes out or comes out. And you don't have to clean it all down the bottom. These are all healthy teeth now, and they've done thousands of them. I mean, you do 8 on every patient you do this on. Now we're going to pack that in there. I'll take an amalgam plugger and I go in there and shove that in. Now the little girl, looking at it here, she's thinking, my God, you rascal, you really messed me up. But this little girl went off and got married and never had orthodontics, and she brought her child back from another town for me to do the same thing to her child, so she wouldn't have to have the orthodontic done. Now, look here, the midline is right on. These teeth are in there. This lateral that was way back behind is in space. Over here, the bicuspids are falling into the space we cut down on the bottom. I haven't put one thing in that person's mouth other than providing the space that they needed to erupt in there. Now, they all won't work out, but out of 10 people like that, there'll be 3 or 4 of them that won't need any orthodontics. I say no orthodontics. This is the best orthodontic you can do. I mean, the body, the forces, puts it in. Have that child, if that child nursed for a long time, they can have developed their airway and they can breathe good, they swallow good, they don't have any deleterious habits. They also absorb some resistance to allergies. Allergies are a real problem, though. Now they're lined up like that. Now, this isn't perfect here. Now we're going to come in and we take the deciduous cuspids out up above, and then you reduce these deciduous molars up above, and you watch where that lateral comes in back here. Look how that this second bicuspid absorbs and takes in, and this cuspid that was sitting out here, the tongue moves it into position. Now, why is this not taught in pediatric schools so that this can do this and prevent the people from ever straightening their teeth on many other cases? If you have to come back and do a little bit of touch-up stuff, you can do that too later on. Now, when this piece of the deciduous tooth goes, there's more room than needs to be for the second bite. This 6-year molar will move forward a little bit when this piece goes right there. Now, we don't have control over the cuspid coming up here, and it doesn't have enough space. Now, you may have to come back and correct the cuspids up above, something like that. Now, the bite is closing down a little bit. We should not stop kids from gnawing bones. I mean, if you feed them a chicken leg, let them gnaw the bone. Don't have them cut the meat off and then eat that. And let them eat and chew with their front teeth out here. Now, we're going to cut these out, and this is going to come in. Let me go and show. And see how that cuspid moved up in that space. It couldn't be better. The force back here is equal to the force out here. Line these teeth up, and that's where they want to be. I don't give a darn whose cephalometric analysis you're going on, and they tell you they ought to be. This is where they ought to be, and this is where they are, and that's a fact. Now, there we're going to take this piece out right here, and there'll be room for the second bicuspid to come in. So now they're a little happier. They didn't have to have their teeth straightened. And that's the girl later on. She got married and brought her own little girl to have that done. Now, I have taught this for years. We started doing it in 1960 something, and I published it in 1970 and got so much on that till I eventually, by 1970 I just quit doing everything but orthodontics. And this is a fact. This works. If you want to try it and learn how to do it. And you can do these pulpotomies, and you can do thousands of them. I've never had one go bad that I did. Now, I'm going to close out and say, try this. This works. And this ought to be taught in the pediatric department in the dental schools all over the world. And this is ridiculous that the people in the head of the pediatric dental deal even stopped our people from coming and teaching orthodontics at their annual meeting. I don't know why in the world they're doing this. Now, we're going to stop, and I